Hi, everyone. I'm Dani Klein Modisett, the founder and CEO of Laughter on Call. And if you're joining us for the first time, our whole mission is about breaking barriers and building bonds one laugh at a time. Yes, and we always have a focus on mental wellness and human connection because we actually launched in the healthcare space, helping people facing Alzheimer's. And when I say people, I mean my mother first. Yes, I was a comedian for 20 years and I taught stand-up at UCLA for 10. But when my mother became depressed facing Alzheimer's, I couldn't make her laugh. But I had the idea to hire a comedian to help her, someone who wasn't her daughter. And it worked. So she started eating again and joining in her community, and the results were undeniable. And that's how we launched Laughter on Call. And what's really amazing is our guest today knows all about Laughter on Call and has such a similar mission, which we are going to hear about human connection. So with no further ado, let me introduce Scott Kaiser. He's a doctor and he is a board certified family physician. Number one, he is the CEO and founder of Determined Health. CEO and founder of Determined Health, a company with a vision for a new approach to community care, one that starts with human connection first. What? That's what we do with laughter. So he's a board certified family physician and geriatrician with executive leadership experience focused on the improvement of aging services, geriatric care, and population health. Engaged in clinical care, teaching, community outreach, advocacy, and research, Dr. Kaiser is the director of geriatric cognitive health at the Pacific Neuroscience Institute, an adjunct faculty member of the USC Leonard Davis School of Gerontology, and serves on the boards of several nonprofit organizations. He is determined, as we're going to learn, to solve healthcare's greatest challenges and create healthy communities that support us all in living well and aging well. So please help me welcome Scott Kaiser, Dr. Scott Kaiser. It turns out we share this client. It's been really remarkable. I can let him talk a little bit about that. So yeah, that's what's been amazing. And then turns out now all of our missions are so entwined, starting with human connection first. So yeah, if you could talk a little about your client, that's awesome.
Yeah, no, it was, I was very impressed when I learned about what you were doing through the Milken Institute Alliance, Dementia Care Alliance, or whichever format, group that was. And I was just really impressed because, for me, thinking about laughter as an important part of health and healing, and thinking about creative engagement and thinking about connection, I just could tell that you were coming up with a really novel and really intuitive way, but just not widely available enough way to really help people. So then, I was sort of really intrigued from the beginning, but then serendipitously, as you said, the wife of my patient, who's a very dedicated family caregiver, encountered something about Laughter on Call in some article, like something she just saw in passing, and she gave it a shot. And so then she came back and was telling me about the profound effects. And as I would continue to follow up with this patient, I would just hear more and more about this deepening relationship and a very impressive kind of engagement in somebody who's very impaired. Really, there are a lot of challenging aspects to this situation, but hearing about the type of connectivity, the type of relationship, the type of bond that the Laughter on Call person was able to deliver, to connect and offer to my patient, and then it's just really blew my mind. So it was so glad that we now have a chance to connect further. I mean, it's just it's one thing to hear about something conceptually and be interested, but then to be able to see sort of the testament to that in a actual patient struggling with real challenges. it sort of takes things to a whole nother level.
Yeah, thank you. That's and it's actually such a testimony to the power of laughter to create human connection and bonding. You know, you mentioned that they were bonded and that he remembers his name and
Yes.
that there's a real connection, and that really speaks to the unique experience of sharing laughter with someone. And what we have found remarkably, going back to 6 years ago with my mother, was that even when there's no language, I'm not suggesting your client doesn't have language, but as my mother progressed and as other clients of ours have progressed, you can still create a connection and through laughter and through physicality, tone of voice. There are ways to still connect beyond language. And when you get people laughing, they feel seen and heard and less isolated. So,
Yeah, I mean, the power of laughter, absolutely. And just the power of being persistent in an effort to engage and not doing what we all too often do is sort of just give up on engagement. That's sort of the status quo.
yeah,
And I think to just not give up and to be determined to create meaningful engagement no matter what, this, as you said, even if somebody were completely nonverbal, you can still connect with a person. Even if you're sort of trying to penetrate to that deepest emotional level, reptilian brain, like how do you just still connect with people no matter what? And then also, I think bringing people with a unique skill set
right.
and engaging them in a way that could help people is really a win-win. It's really great, right? To think about, as a comedian, and I know different sort of modalities, whether it's stand up or improv or, but to take the skill set that someone has developed and refined, and then to be able to use that to really drive engagement. I think that's great. I mean, we always, we often talk about kind of learning to speak dementia, and we spend a lot of time working with caregivers, thinking about how to effectively communicate, how to adapt, and how to deal with very complicated, triggering situations, and learning that dance and learning how to do that dance with, someone with dementia and being able to sort of embrace and accept their reality. It's something that, it's something that can be taught. It's something that can be learned, but it's not necessarily, some people sort of have an innate sort of intuitive sense of it. Some people have certain skill sets that would put them in a good position to be able to do that. And then there are other people who are even in care professions, who've been caring for people with dementia for a long time, who don't have that skill set. And that's a problem. That becomes really problematic. So I think that's such a good idea. I'm not saying that automatically by being a comedian, you're going to know how to effectively communicate with and engage people with dementia. But I imagine from what I've seen, at least with my patient, that's a big part of what you do is you take people with this pre-existing skill set and then provide additional training and support and guidance and help them become this really special instrument of care.
Yeah, yeah. I mean, you said so many things because that was the moment that I experienced with my mother laughing like that. And that is the moment where I said, oh, wait, like comedians are uniquely qualified to do this. And not all stand-ups, because you like contemporary references, pop culture, none of that is relevant. But the ability to monologue and to stay in the game, which I think is what you're talking about, not giving up and being able to just monologue about personal, funny observations, like that is such a gift. And it's particularly a gift in someone who is retreating, to continue to engage like that. And then the improv piece is an additional piece. So yes, exactly what you're saying. We find people who have an innate gift, and then depending on where their strengths are, we bring in the other tools that are needed. So for example, someone who isn't as familiar with improv, that's a really important part of our training, because the yes and mitigating agitation by not being non-confrontational and redirecting, and also, walking with a joyful spirit when they're there. And that's super interesting. I don't know if I told you, so Laughter on Call was a case study for Harvard Business School. And so we went, and, I went and I talked to everybody, and, their question was, well, when you're hiring, what are you looking for when you hire? Is it the funniest person in the room? And, no, like, it's not about that. It's the most generous spirit in the room. It's the and obviously with a comedian background and training, but it's so important because I'm sure you're familiar with mirroring, and how much. So for anybody who doesn't know, that's a big part of the cognitive decline engagement, is that they will mirror back even when they don't have language. They're very, very emotionally sensitive, and so they will mirror back whatever you're bringing, they're getting. And so that's why it's so important. And part of what we talk about with our people is you have to be the solution. You have to come in, especially for families, right? You're the one who's going to come in and change the energy in the room, and be also an example of positive engagement where you least expect it. So that is everything you talked about is exactly spot on, and actually why I thought, oh, I have to do this. This is so valuable. So that's been terrific, just terrific. But I would love to hear more about determined health, since you're human connection first. Like, that's fantastic.
Yeah, I mean, and I know we're going to talk a lot about kind of how I think about this concept of whole person care
Mhm.
and integrative care. But, founding Determined Health was really is sort of a manifestation of many of these beliefs that I've had for a long time, that my co-founders have had, in terms of, Catherine Steinberg, our co-founder, is a healthcare transformation specialist. So really thinking about whole person care, integrative care, and how to transform systems of care, so that we're really on a mission to transform care in a way that it's really built upon connection and trust, and really meeting the needs of the whole person. Things that are really desperately missing in care these days, right? So, I really, when I think about the Determined Health journey, it starts with a patient that I remember, I think of all the time, who I was seeing in my clinic. Um, she definitely had some cognitive impairment, and was really just struggling in many ways. I mean, she'd come to all her appointments. She'd show up early, really well put together. We do all sorts of screening tests, to see what was going on, and everything was always fine. And whenever I'd say, well, what's going on with this? Oh, I'm fine, doc, I'm fine. But clearly was not, all sorts of problems, ending up in the emergency room all the time. And so then I was at the Motion Picture Television Fund at the time, and it was, which is a really great organization, happy to talk about that, as well as their chief innovation officer, really thinking about social drivers, social determinants of health, and thinking about health not just in terms of clinical care, but more broadly in
Mhm.
terms of how you can address all these social, environmental drivers that so profoundly impact health and well-being and outcomes and costs and all of that. And so as part of that, I became very much interested in issues around loneliness and social isolation. So we
Sure.
said, okay, we were trying something where we set up a friendly call program. It was called the Daily Call. It is still called, still going, the Daily Call Sheet. And, we were matching people who might benefit from some added connection with a trained, friendly volunteer. So I asked this patient, I said, you know, would you be interested in trying this new thing that we're trying out? And I knew she'd say no to everything, any help I ever offered. So I certainly couldn't say, I think you're really lonely, this would be good. Definitely not. That approach wouldn't work. And then I couldn't really sort of make it like I was, giving a sort of handout charity. So I kind of framed it as, would you help me? It's a project I'm working on, because we just, had that kind of relationship. So she was willing to give it a try then. And it was amazing. It turns out she was extremely lonely and isolated. They're
Mm,
not the same thing. Um, Her isolation, I would characterize, as the fact that she could go days without talking to another person. The mail carrier would come and she could talk their ear off, because might be the only connection she'd get for 2 days, right? She'd come into the office, talking to the receptionist and our team and the medical assistants. I mean, that was her interaction for the week, right? So, and also with that kind of, so just very objectively isolated, but then with that, feeling very lonely,
mhm,
feeling like she had nobody she could really turn to.
mm,
So no real kind of reliable, meaningful support and
mhm,
trusted support. And
mhm.
then also just this craving, like thirst or hunger, like just wanting to be better connected. Um, and again, even though we had screened, we did something called the UCLA loneliness screening. We did all these
Right,
things. She would always test fine, but she
right.
she was lonely and isolated without a doubt. Um, and so she was paired with somebody who just, they had a common interest in old movies. She'd have Turner Classic Movies on all day, and they would just talk about, they'd even have sometimes be on the phone watching Turner Classic Movies together and just talk about old movies. And
Mhm,
but then she just started doing so much better.
mhm,
Her health
mhm.
improved in so many ways.
Wow.
Um, she wasn't going to the emergency room all the time. I was able to get her better engaged in managing other things. And then also, we were able to identify things and get her to accept help. Like, again, did all these screenings, but found out that she really was struggling at the end of every month as to whether she could pay for food or medicine.
Oh,
And then we
wow.
were able to connect her with Meals on Wheels. And
Wow.
um, you know, before she wouldn't take Meals on Wheels because she thought, oh, it was charity, a handout, she didn't want it. But
Wow.
the volunteer was also a Meals on Wheels volunteer and said, oh, no, it's a great organization. Hey, if you feel that way, you could volunteer too. Like, this is for you. You should do it. So it was just amazing. And it was such an eye opener to see this with this patient. And then she's really emblematic of then countless others who
Right.
I saw having this same kind of experience and impact. So, we knew that loneliness and social isolation is as bad for you as smoking nearly a pack of cigarettes a day,
Right.
right? We know that it clusters, particularly in older people, it clusters with other problems like if you're chronically lonely, you're more likely to experience also chronic pain,
Wow.
depression, anxiety, sleep issues, fatigue, all of these things that are very difficult from a medical context to address. Do they cluster? And then also other social needs cluster with social isolation too, so that if you're isolated, you're more likely to also have financial needs, transportation needs, all these things. So like we knew all of this from a sort of research perspective, but to
Right.
just see the manifestation of it and the transformation in patients and in our community, it's just really an eye opener that wow, we're doing this backwards. There's all sorts of ways that we're coming up with new, better systems of care, and a lot of it for good reason are organized around reducing costs and improving outcomes, which makes sense. But you'll build all these things and then you can't even get people engaged because they're not trusting it, or they're saying, oh, what, that's not for me. I mean, I remember we had a walking club and the health plan was offering this thing where they would have nurses come to the home and do these great assessments, and they were saying, why do they want to come to my house, what are they
Right.
after, right? And I was like,
Right.
well, I mean, maybe it's a good thing, that,
Yeah.
but so if there's no trust, there's no engagement, you could build the best thing since sliced bread and it's not going to get you anywhere. I said, we're just doing this backwards. So we said, what if we reversed the whole thing, flipped the whole stack, and we said, let's start by just building a way to scale meaningful, trusted connections first and foremost.
Yeah,
Then let's think about how you build really good bridges between community resources that are out there. I'll talk about that, that's the stuff I really kind of believe in. That's the sort of the miracle drug stuff, is all these great community resources. So really build better bridges between community-based resources and care, healthcare. And then you could start to layer on care teams, telehealth, more traditional clinical model stuff. And I said,
right.
well, let's not build a clinical model and then try and add those other things as appendages. Let's build this core whole person connection first approach and then layer on the clinical pieces and paraclinical pieces. So that's the Determined Health story. I mean, and that's how we've ended up where we are today, where we're working with managed care organizations,
Hmm.
working with health systems, and working with community-based organizations across the country to deliver this connection first approach.
Right. I mean, it's so fascinating because and I'm sure you've heard the phrase therapeutic lying, which at first people are always like reticent, but it so helps. And many times our comedians are a journalist, or we had one who is there was someone who had been a singing teacher and his a professor of singing. So we sent someone as a singing student to go,
Mm,
and he'd written a book. So she would walk in with the book and they would go through the book and he could kind of regain his dignity and not feel, whereas if we said, well, we're sending someone over, who's gonna help you, like they don't, there's so much inherent shame initially and hiding it, and don't compromise my power and my dignity. So you have to find ways in, and that's where the creativity comes in, and like having people who are comfortable kind of walking in as something else in order to make the connection. And then once the connection's made, it's made,
right.
and
Yeah.
you create the
I
trust.
mean, well, that's the thing is, we know that loneliness and isolation are huge health risk factors, right? As I said, like smoking a pack of cigarettes a day, increase your risk of early death, dementia, all sorts of stuff. But we also know that living with dementia, it's sort of a double-edged sword. One, loneliness and isolation increase our risk of dementia and worsening cognition.
Mhm.
But also the experience of living with dementia can be extremely isolating, and it becomes this vicious cycle so that rates of loneliness and isolation in people living with dementia are extraordinarily high. And then similarly, if you're a caregiver, caregiving can be a very isolating experience no matter what, and rates of isolation and loneliness in caregivers are high. Um, but then of all the caregiving, roles, caregiving, providing care for a loved one with dementia is really high on the list in terms of how isolating that can be. And, I
Mhm.
remember the wife of a patient telling me, I can't even, go to the supermarket because I don't know if my loved one's gonna do something erratic. And my friends tried to be nice and keep coming around. Our friends tried to be nice and keep coming around, but they kind of don't understand, and they've given up. And
Yeah.
so it just all the stigma, the shame, and
And
just
it's
the challenge.
contagious, is it like they feel it could be contagious, they don't want to be around it.
Oh, right. Yeah, that particularly in senior
Yeah.
communities, older adult
Yes.
communities, that's a real phenomena that's
Yes.
really hard, is that sort of the scarlet letter, the kind of the casting
Yes.
of people with cognitive impairment. So, there's just a lot of, we live in an age segregated society. We live in a very non-dementia friendly world overall, right? I mean, somebody was just telling me today, gosh, we went for an X-ray and said, man, it's just the world's just not designed for people like, my husband, for people living with dementia. So I know there are people working on that stuff, and we just need more and more of that, but it's hard. and
Well,
just
that's a
can be very isolating.
right. And now that became a big part of the Laughter on Call mission, interestingly. So we were on an episode of The Doctors, and they did kind of B-roll of my mother with her caregiver, and we talked about the mission and the experience. And the most senior doctor on the panel got like super weepy. And so the camera panned over because they were like, "Oh, that's good TV. What's up, Mr. I forget his name, why are you so upset?" And he said, "Well, I realized I could have done more. I could have shown up more for my mother." And so that then became part of the mission, was like giving people tools to show up because they don't know how. And my father died of cancer 30 years ago. There were people there until the day before he died.
Mm,
And when my mother was diagnosed, like within 6 months, she was down to like one friend who would come. And there's always going to be people that are like, well, I just want to remember her the way she was, that kind of sector of the population. But then there's people who would show up and they want to, but they're afraid they're going to do it
yeah,
wrong. And so, you give them tools and ways of showing up, and then they don't have to end up crying 20 years later that they didn't do enough. So,
yeah. In terms of that, remembering people the way they were, or they don't remember my name and stuff, it just,
mhm.
memory is so overrated, right? I mean, think about like enjoying a great meal, right? Is it about, that you is it, I mean, who cares what you remember or don't remember? How about just the joy of, the full sensory experience of enjoying a lovely meal and then laughing and enjoying life, right? And it's like I would give these presentations in collaboration with Alzheimer's Los Angeles, an amazing organization.
Yeah,
And there
yeah.
was this slide in there that I never understood for a while. I was like, what are they trying to say? And now I really get it, actually. And I think it's helpful. They had a picture of a bookcase, and they were like, and they had stuff on the top of the bookshelf that was like, higher level thinking, like it's that stuff that would help you solve a math problem or whatever. And then like down on the lower shelves, there was like strong, deep emotional things, like
Mhm.
sadness or joy and things like that. And they were like, now if an earthquake came along and the bookcase started rocking, the books on the top shelf would fall off first, right? But then the books on the bottom would still be there for a while. And I get it now. I didn't get it, but I think it's an apt metaphor, right? That when you have Alzheimer's or another type of neurodegenerative illness or anything that's going to result in dementia, there's this process that's causing you to lose certain higher cognitive functions first. And the last thing to go is going to be that more innate emotional kind of aspect. And I think if we can understand that, it helps us in so many ways in terms of being able to still connect with people. I think that, and really coming to terms with this notion of being comfortable with sort of flexibility around reality and accepting somebody else's reality in that moment, right? I
Yeah,
think if
yeah.
you're too logical and you go through and you just say, this is black, this is white, you're going to have a really hard time, as opposed to understanding that, like, hey, if you were, a bat, you're experiencing this reality one way. If you're a human, right, that their reality is not all one thing. It's all about how you perceive it. So understanding that you're with somebody who's perceiving reality differently, and instead of trying to impose your perception onto theirs, adapt, try and focus on understanding, trying to figure out, solve the mystery of what they're experiencing, and then adapting to theirs. Uh,
Yeah.
I think
So
those
much.
kind of concepts, and that's what I know your people are doing, which was so cool.
Yeah, yeah. First of all, I love that book analogy. We work with Los Angeles Alzheimer's Association all the time. I love that. I love it's so true. I've experienced it many times because the emotional spirit is still there and even more accessible because there's no static of intelligence, and it's just so pure. So just
Yeah.
recognizing that. And yeah, that's the whole experience with any kind of improv, therapeutic improv, is that you're not going to argue. You're not going to say, no, dad's not coming. You know, not that I'm exaggerating to make the point, but I've just kind of seen it too. Um,
Oh, sure. Yeah.
like just to say yes, and it doesn't cost anything
Right.
to say yes and build on that and take people out of their pain rather than reiterate, no, dad's dead. Like, no, like that reality is not helpful. It's not helpful. So I love that. So this is kind of a great segue into this whole idea of whole person health and what that means in your experience.
Yeah, so and again, we were talking about determined health and systems of care, and I know so much of this stuff is sort of easier said than done, and our healthcare system is broken in so many ways. And I think the people who experience the greatest sort of brunt of that may be people living with dementia in terms of a system that's just there's a misfit between their needs and the way the system kind of works, and it's really unfortunate. But hopefully, we're changing that little bit, one bit at a time. And again, I think the whole person care concept, I would think about it, on many levels. So one, I think about it sort of as a geriatrician, a physician who trained in the care of older people, specialized training, fellowship training in that, and that's been my focus uh, for many years now. Rather than sort of our typical medical training that's broken down by organ systems and very much focused on figuring, diagnosis, differential diagnosis, and then, treatment options, whatnot. I think thinking more holistically in terms of number one, the overall function of the person and the experience of the person as a whole, and then understanding all of the potential, still thinking about all the different organ systems, but thinking about how they might change with age and how there could be, interactions. Because people get into trouble where, they'll go to one specialist who will prescribe something and it might solve that one problem, but then have side effects, related to that. And then they end up at another specialist who might start something to treat the side effect from that,
Uh-huh.
then another one, treat the side effect of the side effect, right? So that's a sort of problematic thing if you think in too siloed a way across organ systems. So I think thinking about the whole person, across systems, and then within that, obviously, thinking beyond this pretty, odd divide between mind and body, right? So thinking about emotional health, psychological health, all in concert with physical health. So I think that's sort of one layer of whole person. The other layer of whole person is the fact that, as I alluded to before, we know that social factors, social, environmental, behavioral factors, they really drive upwards of 70, 80+% of clinical outcomes.
Wow.
Every day, I just looked at another study out of this big data set, the UK Biobank, and they showed, once again, genetics were a very small component there. They were looking at longevity and health span, and genetics were a very small component. So genetics, being a very small part, and then clinical care, all. It's a good thing that I don't think I have a big ego about my medical side, because recognizing with humility that what I can do in terms of my diagnostics and prescription is very important, but that it's still a pretty small part, right? So then understanding the health behaviors, the physical environment, our relationships, social factors, all this stuff is really the lion's share of impact. So understanding that in terms of whole person, that physical health, but also health related social need, and thinking holistically. And then finally, whole person in terms of thinking about an integrative approach, right? That in one patient, I may be suggesting friendly calls, or laughter on call or meditation, and also providing, recommending maybe for the appropriate patient an FDA approved, antibody infusion that is targeting, it has a molecular pathway to target amyloid plaques in the brain, right? And so, as
Wow.
opposed to what we all too often is you have somebody who's over there on that side of the spectrum with the very, the scientifically driven Western medicine exclusive approach, or you have somebody who's really strong in terms of holistic therapy
Mm-hmm.
and non-medical, but to be able to make sure that you're inclusive of all of these approaches, so I think those would be, I could probably think of other components of what I would say a whole person and community and integrated approach would be, but those would be the main factors.
Yeah, so I have a couple thoughts. First of all, can you revisit what is 70 to 80% is non-clinical? Is
Okay,
or
well, the statistics around this, it gets nuanced and changed, but I would say it's fair to say that yes, upwards of 70 or 80% of health outcomes are driven by social, environmental, and behavioral factors, with
amazing.
clinical care and genetics playing, a smaller role. Um,
So powerful.
yeah. And
And
so, and with that, look, I mean, clinical care, if you're using clinical care to also drive behavior change and address social factors, then it can become much more powerful. And that, coming back to the patient I was describing earlier, I asked her, I said, you know, well, why didn't you tell me about these struggles with this issue? And she said, well, those aren't doctor things. You're my doctor, right? Why would I tell you about my financial problems? Or why would I tell you about the fact that I'm feeling lonely? She didn't even realize maybe, or why would I tell you about, issues around transportation, right? But the fact of the matter is, it's sort of a learning curve for all of us, because you might not think of that. You might say, okay, I have a cough. Do I need antibiotics? Doctor thing, right?
yeah,
But at some point, we need to think more broadly that if I want you to thrive and be well, I need to know also about how you're doing, what your living situation, the air you're breathing, your financial situation. I mean, all of those things play a role. So again, for the medical community, there's a huge learning curve there, but also for patients and families, in terms of broadening our concept of what we think, care should entail.
yeah. I mean, I'm listening to you, and that the word that keeps coming to mind is time, and what an unusual doctor and perspective that you have, because I went through the process with my mother, and like you have a half an hour max, max, right? And so they are just checking. Can you read the clock? Do you know what day it is? Okay. Are you eating? Okay. Like you don't have, it's such a luxury. To me, it sounds like such a luxury, the kind of healthcare that you're talking about. And so I think, that speaks to the bigger healthcare system. Like, how can we create the relationships that you're talking about when people have to see a lot of people to make their numbers, just speaking, kind of in that bottom line way. So I think that's one of the challenges. But maybe teaching people to ask these specific like different questions, right? Can expedite the experience and still get them the information.
Yeah, and it's unfortunate how, you know, um, sort of the many of the barriers between care the way it is now and care the way it should be are certainly financial, but also just political too, right? And so that really is sort of the idea of the one of the driving principles uh, behind transforming care has really been a move to value-based care. And that movement sort of changes depending on, political tides and whatnot. But the concept of value-based care is that, like, hey, the finances of care shouldn't be organized around widgets delivered, right? The care should be finances of care should be organized around actually delivering better results and people doing well and focusing on ways that people could do better and that savings could be realized, right? Like if you can invest the time to do a good job so that somebody doesn't have to go to the emergency room, it's a better experience for everybody and you've saved a lot of money, right? If you can keep somebody out of the hospital. So, I mean, that's really what it's about. And that's what I like about what we're trying to do with Determined Health is use folks who do have time to give, who can
Mhm.
spend time talking to somebody on the phone, but aren't clinical, and don't have a clinical training, but can just invest the time. Then what we've been doing with the technology we built is enabling them to be an early warning system and identify unmet needs and route that back to care teams so that the folks that need to know about that in a timely way, right?
Mhm.
So, because, I've been very fortunate in that I do get to spend a lot of time with patients, and it's something I'm unwilling to compromise on. But the system's not really set up for that. And even to be honest, it's never enough. I mean, I've had folks that I'm on seeing for an hour for follow-up, and we could keep going, and they would like they need more, and I need more, and I get that. But so that's where at some point you've got to think about the team, and you got
Mhm.
to think about, okay, each person has their domain and area of expertise. So how can you really best leverage them and then have a team where maybe there are others on the team who could have more time?
Yeah.
Example, there are others on the team who are really focused on, right? So the idea if Laughter on Call could have people who are part of everybody's team, if Determined Health could have people who's part of everybody's care team, think how much value that brings to the whole unit.
Right, because you create the trust, and when you have the trust, then they're more willing to share. And there's this idea that if you want to get people listening, get them laughing first. If you want to get people talking, get them have the bonding experience of laughing, and then they will tell the truth. So I completely, I really agree with what you're saying, obviously. We're open to
Yeah.
questions. If anybody wants to send in questions, we're available for that as well. Um, so
I mean, I believe with laughter, obviously, the other thing that we haven't talked about, and I think that fits into whole person care
please.
too, is just, and again, anybody who's on, who knows, healthcare policy, whole person care, it's sort of a technical term. So I'm thinking beyond sort of the jargon, and let's just come up with a good way to say the whole person and the whole context. And I like to think about person-centered, family-centered, community-centered,
Right.
because it's really those layers. And I think probably part of that is training as a family physician focused on underserved communities, thinking about community health. But we've talked about laughter, we've talked about kind of the whole person, community integration. I think just creative engagement, period. I don't know if anybody, if somebody's listening out there and can connect me with the people who made a beautiful film. I think it was called I Remember When I Paint. It was, and I probably should just look up, but it was great. Oh, and it started out, they had the story of Rita Hayworth, Hollywood legend, Rita
Yeah, yeah,
Hayworth.
yeah.
Apparently, she was living with dementia and started painting a lot. And she had been a dancer and all these things, but wasn't a painter. And by the way, the paintings looked gorgeous. I want to see one in person because in the film, they were really spoke to me. So if anybody out there can ever help me find a Rita Hayworth painting, or the filmmakers of this, I Remember When I Paint. And it was this whole film about the experience of people living with dementia and the
Hmm.
power of creative engagement. And some of it was, Alzheimer's LA has had a program for years where people paint, but some of it was even just going to a museum right? And I think LACMA does this, where people living with cognitive impairment can go engage in just seeing somebody who, is nearly nonverbal, being standing in front of a great work of art, and all of a sudden having a conversation with the
Amazing.
piece and about and with the people around them. And I've seen that time and time again with music, you
For
know,
sure.
great LA-based company, SingFit, doing incredible work with scaling music therapy. So I'm such a believer in the power of the arts, um, and creative engagement. And I love that that is core to what you do.
Yeah, yeah, yeah. I don't know if you've ever seen there's a beautiful, also short film about a former ballerina, and she's kind of folded over in her chair, and then she hears the music and she starts the arm movements of the dance that she did. So brings people to life. Do you remember the name of that movie? It's
I
not
believe it's, if somebody could search it real quick, I believe it's called I Remember When I Paint.
Remember When I Paint. All right. We do have
Yeah.
a question. What are some ways to connect with people who are starting to have Alzheimer's or in early stages?
Oh, so that's a great question. Before I answer that, let me just say, um, early detection is so important and a huge missed opportunity. People are not
Mhm.
getting diagnosed early enough. And we still have a system too where savvy people will, through the internet, figure out that they may be actually experiencing some cognitive impairment, and the system isn't kind of ready to deal with it. And they might go to their doctor, and their doctor might say, "Oh, don't worry about it." So that is not good. We have a huge problem, and there's a lot of folks in the system who still feel like, well, there's nothing you can really do about it anyway, so what's the point? Who cares whether you detect it early? And that's just so not true. There are so many layers to which to that we should be contesting that entrenched line of thinking. Early detection really is a key. Um, if you can detect mild cognitive impairment early, you can significantly reduce the risk of somebody progressing from mild cognitive impairment to dementia through lifestyle interventions, through addressing modifiable risk factors, huge factor, and people just are not getting detected early enough. And now there are new treatments, and the efficacy of those treatments and the impact of those treatments is a subject of great debate. But for the right patients, these may in fact have a significant impact. And so none of that's possible without early detection.
Right. I think people are afraid. I mean, I'll be honest, I'm afraid. I feel like I have not had the APOE3 test because I feel like I'm highly suggestible. If you tell me have a tendency, I'll be like, who are you? Like, it will just escalate very quickly. And I get worried about that. But having heard you talk, and also this very recent, because I even saw an ad last night on TV for an amyloid plaque deterrent. So
Right.
I do think they're in support of what you're saying. Now more than ever, it makes sense to have the information because there is actually help.
Yeah, and with regardless of your stance on big pharma and whatnot, now that there are FDA approved drugs, it's going to have be an incredible force in driving efforts for early detection, which I think is really wonderful. And by the way, in terms of the ApoE genetic testing, that's a matter of debate. I think I'm not saying whether you should or shouldn't have that done, but I think it's important to keep in mind that everybody should know that this is one gene that is associated with increased risk depending on what type, genotype, what allele, what type, whether it's an E2, E3, E4, this little type of ApoE gene, and whether you have one copy or two copy, but it's not deterministic. It's not a gene that says, if you have this, you will get. It just tells you a little something about your risk. And some studies show that, people who know that information are more proactive. If they
Right.
know they have some increased risk, they're more proactive about doing that. That gene becomes more important when you're considering these anti-amyloid drugs because of potential side effects with that. But that's a whole nother topic to talk about.
Yeah, I mean, I'm mostly kidding, but I am curious, like where, and I get asked this a lot, like what's the fine line between I've parked and I have no idea where my car is and early onset dementia? Like, how do you know when the symptoms are reflecting disease or when it's just like, I'm a postmenopausal woman, like, okay, just trying to bring some levity into the
Yeah.
room. No.
I think having some professional perspective on that is really valuable. And the key is if you're worrying about it, get it checked out because worrying incessantly is not good either, right? Stress, chronic unchecked stress. So if you're worried about it, get it checked out. Hopefully, what your assessment will all be very reassuring, and then you can relax. But that's a big problem is start differentiating what's just life,
Yes.
um, and what's actually something to be concerned about. But so that's, again, my plug for early detection. And I think the question was about connecting with people early
Yes.
in the
Yes.
disease.
Yes.
And I'm not sure I totally understand the question. If I don't get this right, I want somebody
Yeah,
to,
well, I can help with that as
yeah.
well. I'm interested in your
But
take.
but I think that's really I think about when people are early in the disease, and right, there's a concept where people may lack insight into
Yes.
their cognitive impairment, and so
Yes.
that's very common in Alzheimer's disease, but not, it's variable, right? How much insight. So I think that really focusing on building connection early when people still have more cognitive skills intact is critical. So the metaphor I always think about is, so if you have mild cognitive impairment, for example, you're at significant increased risk of dementia. It's not guaranteed you'll develop dementia, but you're at significant increased risk. So if you're in these stormy waters, right, and you're heading out into rougher seas, you want to make sure you have your life raft and that you've got everything you need on there. And you have to think that today may be the strongest cognitive day you're going to have, and that your cognition may continue to just decline. So today is your best chance to sort of help your loved one and help yourself. It's only going to be harder potentially tomorrow. So that's why I think thinking about how to engage through laughter, before it gets increasingly difficult. The one I always think of is, meditation. If you're not a regular meditator, learn the skill now because it's going to help you along your journey, and it's only going to become more difficult to pick up that new skill later. So
Yeah.
we know that as we're cognitively impaired, learning new skills is great. Learning languages, learning instruments, all that. But so try and pick up the skills that you need now. So I don't know if that answers the person's question, but I just think that my answer would be that when you're early in the disease course, it's all the more important to focus on building strong connections and engagement.
Yeah, so I'm gonna yes and what you said with yes and, because it is not arguing, not shaming someone for not knowing, and it's like a personal journey of empathy, especially if you have a previously contentious relationship with this person. It's really a growth opportunity because confronting them is not going to serve you short term or long term. So truly like learning some improv tools of building on an idea and saying yes, even when it sounds crazy or not based in reality, is helpful because you'll maintain the connection with the person. And then also just finding things like music and laughter and entertainment and sharing art, all of the things that you brought out. And I just have to say, we just have a few minutes, but because you're such an entertainment enthusiast, I have to tell them about the Move On Uh,
On the move.
on
Yeah.
the move, on the move. Please tell us quickly about that.
Okay, but real quick, I'm in a yes and about this wonderful question we got from the
Yeah.
audience as well about early in the disease course. The other thing I would say would be what I call a framework for reasoned optimism, right? I think that there's this desperation, this hopelessness, this despair, I should say, hopelessness that, oh, there's nothing you can do, it's terrible, things are just gonna get worse. And then on the other end of the spectrum would be to just be, blindly optimistic and say, oh, everything's gonna be just great, right?
Right,
I
right.
think in the middle is the truth, is that now is actually the best time ever to be diagnosed with mild cognitive impairment or to be suffering, to be early in this disease stage, and that we know there are all of these things that we can do to help. We know that there are better systems of care. We know that there are treatments and emerging treatments. This is just the foot of the path. So I think staying hopeful and optimistic and then being proactive, because what I all too often see is people take this nihilistic, fatalistic attitude and just sort of give up, as opposed to being reasoned in your optimism and then taking a proactive approach to really optimizing brain health. So that's that. And I think that's what On the Move, a project that we did many years ago, we worked with the city of LA, where we went around and we had auditions at senior centers for people to participate in a reality game show, all about being proactive about healthy aging and becoming active and getting fit. And we were trying to highlight resources that were available for free throughout the city. And it was great. And I think it was an amazing experience for everybody involved. But the true pot of gold within that whole experience was that two of our contestants, actually, they met through On the Move and fell in love. And some months later, I was contacted to be informed that they were still dating and everything was going great, and that would I please come to the wedding? And I
Ah,
signed as the witness on their marriage certificate. And in fact, I'll reach out to them after this to see how they're doing. So that was really the highlight for me, is that talk about creating meaningful connection. Um,
so great.
that's what we've been all about.
Yes, 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 yes. And I really love you pointing out that fine line, that art of, you're fine, everything's fine, you're good, good, oh good, which, feels inauthentic to anybody's ear, right? Instead of as opposed to, I see you, I hear that you're uncomfortable, and you know what? There's actually help. Because someone was asking, how do you get somebody to help if they don't want help?
Right.
Well, you ask questions, you stay curious, you really listen and make suggestions, and no shame. That's a big thing. I know for my mother, and frankly, for a lot of men, it's very difficult because there's so much shame in losing power and feeling like you're losing your power. I guess for all people, but I noticed that. And so to maintain respect, but to make suggestions of what might bring relief, if you can get them to be honest. But that starts with you showing up authentically. So I guess we're just a little bit passionate about this subject, Dr. Kaiser. All right, I always like to close with one question. Tell me, if you can, one time you found yourself laughing in a situation or at yourself and you felt better. You were able to find laughter and felt better.
Oh my gosh. I mean, I don't know. I can't think of just one. I laugh at myself all the time. I guess my ability to be self-deprecating helps me a lot in this in my work. But I'm just, I guess, thinking about, like, I remember in medical school we gave this whole presentation and I didn't know how to pronounce the acronym for, like, it was on COPD and I was calling it COPD. And but anyway, that's a famous one, at least in our house. But I can't think of just one. A million times where I've laughed at myself, and just situations where, something is just, there's so much going on, and then it's just overwhelming, being able to, take a moment, laugh, recenter, you know, become mindful.
Mm-hmm.
I think that's everything. And thankfully, I'm surrounded by an amazing family of people who make me laugh all the time, and they laugh at me all the time. So that's great. I don't mind.
Yeah,
That
yeah.
really helps things go around.
Wonderful. Well, thank you so much. Yeah, it is about being able to pull the lens back and put things in perspective. That's the great thing about laughter. So I just want to thank you so much for a great conversation, and thank you all for showing up and asking questions and being engaged. And we do have a link. If you check in the chat right now, we have a link to the movie with a screenshot on it. And yeah, so we'll get that to you, Dr. Kaiser, as well. In closing, again, we're Laughter on Call. If you want to learn more about creating connection through laughter at all stages of cognitive decline, including completely lucid, we would love to hear from you. And Dr. Kaiser's company, Determined Health, please check him out and his work. And we will see you all March 20th with another captivating conversation about human connection and humor. So thank you all, and a round of applause.